Pregnancy is a beautiful and exciting time, but it can also come with its own set of challenges. From morning sickness to gestational diabetes, there are a variety of pregnancy complications that can arise. Today, we'll be discussing some of the most common pregnancy complications and their management. Hello, and welcome to our channel. My name is Your Name, and in today's video, we'll be exploring some of the most common pregnancy complications and their management. Pregnancy is a magical time, but it can also be overwhelming, especially if you're a first-time mom. That's why it's essential to know what to expect during each trimester and how to handle any complications that may arise. Section 1. Preeclampsia. One of the most common pregnancy complications is preeclampsia, which affects about 580 of all pregnancies. Preeclampsia is characterized by high blood pressure and protein in the urine, and it can be dangerous for both the mother and the baby. If left untreated, it can lead to serious complications such as seizures, placental abruption, and even death. So, what are the signs and symptoms of preeclampsia? They include high blood pressure, swelling in the hands and face, headaches, and changes in vision. If you experience any of these symptoms, it's crucial to seek medical attention immediately. Your doctor may recommend bed rest, medication to lower your blood pressure, or even induce labor if necessary. Section 2. Gestational diabetes. Another common pregnancy complication is gestational diabetes, which affects about 2/10 of all pregnancies. Gestational diabetes is a type of diabetes that develops during pregnancy, and it can cause complications for both the mother and the baby. If left untreated, it can lead to preterm labor, high birth weight, and even stillbirth. So, what are the risk factors for gestational diabetes? They include being overweight or obese, having a family history of diabetes, and being over the age of 25. If you're diagnosed with gestational diabetes, your doctor will likely recommend a special diet and exercise plan to manage your blood sugar levels. In some cases, medication may also be necessary. Section 3. Miscarriage. Unfortunately, miscarriage is another common pregnancy complication that affects about 10-20 of all pregnancies. Miscarriage is the loss of a pregnancy before the 20th week, and it can be devastating for the parents. The causes of miscarriage are often unknown, but they can include chromosomal abnormalities, hormonal imbalances, and infections. So, what are the signs and symptoms of a miscarriage? They include vaginal bleeding, cramping, and the passing of tissue or clots. If you experience any of these symptoms, it's crucial to seek medical attention immediately. Your doctor may perform an ultrasound to determine if the pregnancy is viable, and if not, they may recommend a procedure to remove the tissue. Section 4. Preterm labor. Preterm labor is another common pregnancy complication, and it affects about 10 of all pregnancies. Preterm labor is defined as labor that begins before the 37th week of pregnancy, and it can be dangerous for the baby. Premature babies may have underdeveloped organs, and they may require special care in the Neonatal Intensive Care Unit, NICU. So, what are the signs and symptoms of preterm labor? They include regular contractions that occur every 10 minutes or less, pelvic pressure, and vaginal discharge. If you experience any of these symptoms, it's crucial to seek medical attention immediately. Your doctor may recommend bed rest medication to stop the contractions or even deliver the baby if necessary. Section 5. Placenta Previa. Placenta Previa is a pregnancy complication that affects about 1 in 200 pregnancies. Placenta Previa occurs when the placenta covers part or all of the cervix, which can cause bleeding and can be dangerous for both the mother and the baby. Placenta Previa can lead to preterm labor, fetal growth restriction, and even maternal hemorrhage. So, what are the signs and symptoms of placenta previa? They include painless vaginal bleeding in the 2nd or 3rd trimester, If you experience any of these symptoms, it's crucial to seek medical attention immediately. Your doctor may recommend bed rest medication to control bleeding or even a cesarean delivery. Section 6. Management of pregnancy complications. Now that we've discussed some of the most common pregnancy complications, let's talk about how they can be managed. The first step is to seek medical attention as soon as possible if you experience any signs or symptoms of a complication. Your doctor will perform tests and examinations to determine the cause of the complication and develop a treatment plan. The treatment plan will depend on the type and severity of the complication. It may include medication, bed rest, lifestyle changes, or even delivery of the baby. In some cases, the baby may need to be delivered prematurely, which can be scary for the parent. However,